Can you please say and spell your first and last name?
Hi, I'm Dr. Kenneth McClain. That's Kenneth. McClain, MC, capital C, Lain, MD, PhD. I'm the clinical director of the Histiocytosis program here at Texas Children's Cancer Center and a professor of pediatrics at Baylor College of Medicine.
Great. So can you explain Gianna's condition?
Gianna has juvenile xanthogranuloma, which is a disease of white blood cells called histiocytes, and they can accumulate in many places of the body. Juvenile xanthogranuloma, or more easily known as JXG, usually presents as skin lesions, little bumps on the skin that are pink or brown or skin colored. Some of the patients, however, have brain tumors, and Gianna has quite an impressive brain tumor that was discovered in the first few months of life.
Can you explain the progress that she's made?
Gianna's made very good progress with the clofarabine treatment that we suggested that she be given. Her family and her doctor reached out to me when she was diagnosed and asked my help in finding a treatment that would be effective for her. Thankfully, we have an extensive experience with treating children with histiocytic diseases here at Texas Children's Hospital, as well as having published a very important paper showing the efficacy of this drug clofarabine in treating children with brain tumors caused by JXG.
So this is really a story about hope and faith, really a great experience for Gianna and her whole family. Can you talk a little bit about how she's kind of defying the odds?
She has defied the odds because this is potentially a life-threatening tumor, and thankfully the therapy is working and she's getting better little by little. It is a story of faith and hope because these diseases are rare, they're often difficult to diagnose and have been difficult to treat in the past, and it takes a lot of strength by her parents and other people in her family to press on and continue the treatments, which are rigorous and have some side effects, but Gianna's doing quite well. But I think that the faith of this family, as well as their inner strength, has been critical to Gianna's getting better.
Okay, and last question. How important, you kind of touched on this, but how important, as a family, is it to keep the faith and always to be an advocate for your child in any, type of diagnosis, especially this one?
These so-called rare diseases or orphan diseases are so frustrating for the families because oftentimes there's not a lot of information available to them. Sometimes they can't find doctors who know how to treat them, although her doctors in Philadelphia are very good and are doing the right thing for her. But it's still a very scary episode for the family, as they don't really have other people in the clinic who are going through the same thing as they are. It makes them feel very isolated. And although it's a rare disease, it's a terribly scary and important disease when it happens to your child. And that's why I think the faith and strength of this family comes out in that they are able to maintain some equilibrium and continue fighting for their child. And they have to be advocates because it's such a difficult and rare condition that they have to seek out advice and look for the best possible interventions for their child.
Is there anything else you'd like to add?
I think that this family and this story brings up a very important aspect of medicine, and that is that rare diseases can help us learn about a lot of things, about biology and about medicine and about treating children. And our understanding of how to treat JXG, I think, is giving us some new insights as to how these diseases happen, and hopefully will lead us to some new biologic discoveries that will provide better therapies in the future.